Good afternoon. Thank you for joining us across the state on our MTN Facebook pages here. I'm Casey Conlon. We're bringing in Michael Bush, Doctor and Chief Medical Officer at St. Vincent Healthcare in Billings, for a very exciting day at St. Vincent, as the first Pfizer COVID-19 vaccines have officially landed and arrived here in the Treasure State. Dr. Bush, thank you for joining us.
Well, thank you very much, Casey. And indeed, it is exciting to get to this point in our battle against the pandemic. So thank you.
Did you expect the vaccine to arrive at your facility this quickly?
To be honest with you, if you went back a month or so, I would have said this was way quicker than I expected. And then for us to get it at 8 o'clock this morning was even earlier than I expected it, although I knew we were getting it this week.
You're going to start the vaccination process tomorrow with your frontline healthcare workers. Is that correct?
Correct. We'll be starting with those people that are actively taking care of COVID patients or in and out of the COVID room, such as our environmental services people and the emergency department, the ICU, et cetera. But they will be first people up to receive the vaccine. But given the quantity of vaccine we have, we'll rapidly move into our tier 2 distribution list.
We have some video that you guys were able to share with us today. Let's go ahead and roll that. This is you guys unpacking the transport box into your ultra cold freezer, which you have recently purchased, I understand. Was that for this specific purpose?
Yes, it was. This virus, or the vaccine, not the virus, but the vaccine has to be stored at minus 70 degrees. And obviously that requires special equipment. And that's why there's, only the larger facilities in the state are going to be able to receive the Pfizer vaccine.
With this process that we're watching here, this looks like a tech, Steven Anderson, if I'm reading the name tag correctly. What was the experience that you guys had this morning from when you received this box to getting it into this freezer facility? Was it fairly seamless?
I'd say it's very seamless. It's Shane Anderson there, but he's actually, demonstrating we're putting the doses away, and very excited to receive them and to start the process of vaccinations. A vaccine is no good until it becomes a vaccination and gets in somebody's arm. So we're really excited about that part of it.
Take me through that process tomorrow. What can we expect to see?
So anybody we are giving the vaccine to has to be registered with a MyChart account, which is part of our electronic health record, EPIC. And the reason for that is we have to do some accounting for the vaccine, track the people, and then we have to report all of this to the state. So we're letting electronic health records, talk to each other. So we will have people registered, signed up to do this. And then when they come in, they will just sign a consent and then receive the vaccine, be watched for a period of time afterwards, and then released to go about the rest of their day.
Now, each box that's coming to these facilities has 975 doses of the vaccine. Is that just first doses, or does that also include the second doses, which are supposed to be given 21 days later?
So this is the first dose, and the state is guaranteed that those that we give the first dose to will get the second dose at the appropriate time, that we'll get that vaccine so we can administer it. And so this is the first dose. So we're looking at vaccinating 975 people this week.
So that's my next question is, what is that percentage of your healthcare workers? How many with that 975 can you vaccinate?
So we have roughly between 2,400 and 2,500 associates at St. Vincent's. We also will be vaccinating some of the public health first responders, police, fire, et cetera, that work in our community. And then we will be vaccinating some of the residents and faculty from the family medicine residency program at Riverstone Health. But all told, we'll be administering all 975 doses.
So I'm guessing you probably think you'll require another 2 or 3 shipments before you're able to get through your entire staff.
Yes, I would assume that.
With that said, going forward, do you have an idea of, now that you know this vaccine is here today, do you have an idea of going forward what the general public can expect? Those who are not frontline workers, those who do not have any kind of health issues otherwise. Is there a timeline in your head?
So I do hope, and I hate to use the word hope. I would like to say no, but unfortunately it still is hope, that we can start vaccinating the public probably halfway through the first quarter of next year. And we would start with people at higher risk. So if you have any of the risk factors, age, comorbidities, et cetera, then we would be moving to those groups first. But the timing of when we can do that depends upon the supply chain of vaccine that's being provided to the state of Montana and to us here at St. Vincent.
This is the Pfizer vaccine that you received today. Do you have any info about the Moderna vaccine and a timeline where you might start to receive shipments of that?
So the Moderna vaccine has yet to be fully approved, but we're expecting that approval this week, and we're expecting shipments to start next week. There are a few differences with the Moderna vaccine. It does not require the super cold storage, so it can be shipped to facilities that would just normally take medicine that has to be kept cold. And then it's going to be shipped in containers of 100 doses. So a facility like ours, where we have a lot of associates, if we gave a small critical access hospital 975 doses, that would be way more than their need to get to. So with the Moderna vaccine, we can ship those to the critical access hospitals. So my understanding is that those shipments that the state is guiding next week, that we expect next week, will not come to the larger hospitals like St. Vincent's, but will indeed go to the critical access hospitals in the state.
So they'll possibly be kept separate at first, but I assume at some point you guys will run into administering both Pfizer and Moderna vaccines. What are the difficulties that are presented when you're issuing vaccines from 2 different providers?
Making sure that we keep track of individuals and that they know and they're getting their follow-up dose. Both of these vaccines require a follow-up dose. Another one that's in study, Johnson & Johnson, I believe, is just a single injection for the vaccination. But I think for us, it's just keeping it straight and making sure that we are getting the right dose to the right patient at the right time.
There's been much talk around the country about significant pushback from those who say they're not comfortable with taking the vaccine at this point, often citing the speed to which that they were developed. Can you speak to that specifically with your healthcare working force at first? Do you believe most will be amenable to taking the vaccine?
So I believe that we indeed will have a majority that will take the vaccine. I will be first in line when my name is called, so I'll be there. I will tell you that we had a really good session with the Surgeon General of the United States, who was here in Billings last Friday. And as we talk about this, he makes a big point that these RNA messenger vaccines, we have built the infrastructure, the technology over 10 years. And so one of the reasons that we were able to have these vaccines be developed as rapidly as they have been is because the underlying technology was already there. And we just had to plug in the specific information from COVID so that it could be effective. And I think that should be one factor that is really reassuring to people that this is going to be a safe vaccine. And other factors would be that a normal vaccine gets tested in 5,000 to 10,000 people. These test groups were 35,000 to 40,000 people. And so I believe that indeed would encourage people to be vaccinated and really would encourage them to understand that these vaccines are safe.
What do you say to those who are worried about possible side effects?
We do know there are some side effects that can happen. We know that 30% of people that get the first vaccine, the first injection, will get moderate systemic symptoms, which will be things like muscle aches, low-grade fever, and may last 24, 36 hours. We also know with the follow-up vaccination, that rate goes up to about 40%. So we would recommend that you have a day where when you take the vaccine the next day, you don't have to expect much of yourself by working or something like that. But again, that's much, much better than getting critically ill or in the hospital from COVID or spreading it to somebody else who has that kind of risk that they could get really ill from COVID.
Again, we're speaking with Dr. Michael Bush, Chief Medical Officer at St. Vincent Healthcare in Billings. Tomorrow is the day where you start giving the first COVID-19 vaccines. I imagine you've been in contact with some other facilities around the state. Do you know if most of the state can expect vaccinations to start this week?
So I believe that the other doses are going to show up at the other large hospitals in the state tomorrow. And I am certain that they all have plans to roll them out.
Well, we wish you the best of luck tomorrow. Can you put into words what tomorrow will be like as a day for you?
Exciting, relief, and maybe we can see the other side of this downhill kind of trajectory from the pandemic.
Well, thank you so much, Dr. Michael Bush, Chief Medical Officer at St. Vincent Healthcare in Billings. Good luck tomorrow and as we move forward with the rest of your vaccinations over the coming months.
Thank you very much, Casey.